Hi, this is Dr. Robert Antelak from thegentlendentist.com in Shelby Township, Michigan, Macomb County. And our phone number is 586-247-3500. The Gentle Dentist is our name of our website, thegentlendentist.com. What I'd like to do is to discuss something that affects over 50% of the adult population, and that is what's called periodontal disease. Periodontal disease is an infection that develops from bacteria, certain bacteria, that gets below the gum line and starts it's an irritant, and it causes our bodies to sometimes to react in a way that the enzymes that are produced starts dissolving the bone that's around the teeth. So periodontal disease is developed. It is the number one reason why adults lose their teeth, and it's something that is pretty much preventable. It's prevented by getting into your dentist and seeing on a regular basis. Periodontal disease, because it is an infection, a bacterial infection, it is something that is actually transmissible, so you can give it to somebody if they have not diagnosed it with contact with sharing type of silverware and things like that. Periodontal disease, because of the bone loss that's developed, it requires to come into the dentist not only once every 6 months, but sometimes once every 3 months or every 4 months to take care of the problem. Periodontal disease, also known as pyorrhea, loosens the teeth up because as people over time they lose bone around the teeth, it loses the support of the teeth. So we are basically talking about a bacterial infection that affects the body's immune system, that affects the bone around the teeth. Teeth can loosen up and you can lose teeth from it. One thing I find so much in literature and in the scientific community really shows a link between periodontal disease, gum disease, and heart disease and diabetes. And how that is that these bacteria that I'm talking about, they're under the gums and they have quick access to our bloodstream. When it gets into the blood, it can actually build up on the arteries of the heart and start forming calcifications, which can affect the blood flow and eventually possibly stroke and or heart attack that can develop from that. We also know that periodontal disease affects diabetes and vice versa. Because diabetes affects our immune systems in our bodies, for those who are diagnosed with diabetes, our bodies don't have the ability to fight off the infection like we would like to see. And so we find that there are many diabetics who are prone to periodontal disease. The good news is that when somebody gets the gum disease or periodontal disease treated, is that sometimes the insulin levels are reduced, and something called your beta A1C levels are reduced also, which means that you're much more your sugar levels, your blood sugar levels are more stabilized because of it. And also another thing that I find significant is that those people who are smokers have a much higher risk for developing gum disease. It seems like when I get somebody in my office and I start looking at their x-rays and I see that there's bone loss around teeth, and I start asking and inquiring, 90-95% of the time they are smokers. And unfortunately, smoking, what that does is the nicotine, it reduces the amount of circulation to the teeth and the gums that surround the teeth. Therefore, it reduces the levels, once again, of the disease-fighting cells in our blood to that area. So what I want to do is encourage you, if you're not a smoker, certainly don't start. Not only because of our health of our bodies, because of that, but also because of our teeth and how it's the support of it, but also the people that you affect around you. If we are a smoker, I would encourage you to quit. Quitting is difficult. I know that smoking cigarettes, the nicotine, is more addictive than heroin. And because it is, I've never smoked, but I know people who have and how difficult it is. But there are people, if there's a reason big enough to stop, they will stop. I can tell you, we've helped to encourage a number of our patients in our office to be smoke-free. And it's a blessing to be able to do so. And they've been around for years, and they're so happy that they did it because it helps with their ability to taste foods. They can breathe easier. And then also you don't have the issues with the family and the social stigma that comes along with it. And standing out in the winter months trying to smoke that cigarette because of the anxiety that it brings. It helps potentially to calm it down. So smoking is bad, as we all know. Encouragement is to do that, and then just think about it. Would you want your son or daughter to smoke because of something that you influence them to do? So not only does it cause periodontal disease, it causes heart disease and the other issues that go along with it. And people all know about that. So my encouragement to you is to go smoke-free. Set a date for that time. If you'd like to have some help with that, either go to your physician. We also have the ability to prescribe certain medications to help you with that process. And just make a decision and go with it. Not only do that, and then be disease-free in your mouth too at the same time. Thank you, and have a blessed day.